It started when I was referred by my doctor, my personal doctor, to do a colonoscopy, which he's been trying to get me to do since I was 50. I was 55 last fall when I finally got around to doing it.
Some people prefer not to have a colonoscopy, and that's certainly their choice. However, they are accepting a risk that there could be something more serious that might be discovered later.
I had put it off, thought I'll get around to doing that one of these days. Got the results back that I wasn't expecting, and then kind of one thing led to the other.
Mr. Foreman had a smaller cancer on colonoscopy, and his cancer was curable or potentially curative cancer, and he had a laparoscopic colon resection.
You are kind of wondering, when you go in, because they have to cut out a large section of my colon because of where it was, and he was very thorough about that.
These are the stages of cancer and the progression right here. Cancer starts in the surface of the colon, or starts as a polyp in the surface of the colon, and then the polyp undergoes transformation to a cancer, which then begins to invade into the superficial lining, then it invades into the muscle of the colon, then it invades through the muscle later. But the deeper it goes, the more likely it is to spread out to a lymph node. Colon cancer typically spreads through the lymph nodes.
I'll have to do colonoscopies more frequently, but that's a small price to pay for the good news that I got out of this.
Fortunately, he had a very straightforward operation, an uneventful recovery, and he had the type of recovery we wish every patient would have. He was home in a few days and never looked back.
Everything went very smooth with Dr. Simmang. I would highly recommend that anyone who's having any issues, or just simply time to do a colonoscopy, or if having issues where they might need surgery, certainly I would highly recommend Dr. Simmang for that because he's the best.